Running an ambulatory practice today isn't simple. Leaders are balancing patient care, staffing pressures, financial performance, and rapidly changing technology all at once.
Welcome to In Practice, a podcast focused on the latest in ambulatory care, what works, and what leaders need to know to help their practices thrive.
Hi, I'm Jenna Hagan, Vice President of Product Marketing here at NextGen Healthcare. And this is In Practice, a podcast where health tech leaders, clinicians, and practice administrators discuss the challenges ambulatory healthcare practices face every day. And today I'm joined by guest Mohammed Mo Chebli, Vice President of Product Interoperability here at NextGen. Mo, welcome to the show.
I'm so glad to be here, Jenna.
Yes, thank you so much. Well, I'm excited to dive in today. Let's talk a little bit about your background. So give us a little bit of an introduction and your experience.
Well, I've worked in the health tech space my entire career. And here at NextGen, I've been focused on interoperability, helping our customers, providers, healthcare organizations in the US and actually all over the world share data and interoperate and integrate with systems that they care about. I've been at NextGen for more than 10 years, just focused on that interoperability and data exchange space.
That's awesome. Thank you. Well, we're happy to have you today, and we're certainly lucky to have you here at NextGen. All right, let's dive right in. Talk to me about the buzz of interoperability. What's the big news out there? What are all the conversations happening with customers and the market? And we'll dig in.
Yeah, I think a big theme in this calendar year of 2026 is the TEFCA and QHIN framework. So the federal government has established some rules of the road for how organizations can connect and theoretically share a lot more healthcare information than just treatment-based data exchanges. And so now there's a model of how organizations can connect on a national framework, a trusted exchange framework, in fact, to do things like patient discovery, document and data retrieval for things beyond treatment now. So we've always had treatment-based usage on a lot of the national networks that have come before, like Care Equality and the Commonwealth network. But now with TEFCA, we have the expansion of additional use cases. And I think the industry is really grappling with how do we roll this out in a way that's effective, that honors trust and patient consent, and also validates that all of these organizations are bona fide exchange partners, that they are actually who they say they are. And so the industry is grappling with activating TEFCA and standing up QHINs and enabling broad-based data sharing. At the same time, a lot of the interoperability that's come before is now being challenged in the courts in some examples, where organizations are really seeing, did we do things properly in the interop space? Did we authorize the right users to query and retrieve data across some of those previous national networks? So for the first time, there seems to be the testing in the judicial system, some of these established rules of the road that we've had. And we've seen some of the largest vendors getting pulled into some of these cases. So there's a lot that's actually happening on the judicial side and also on the regulatory and framework side. So interop is never a boring space, certainly not in this year.
Yeah, it's certainly a big year, certainly a lot of standards and interop areas and specs that we've been waiting on in healthcare in the industry. And so you're going to see a lot of change this year and a lot of exciting times and a lot of probably challenging times for organizations trying to understand what to prepare for and what do they need to do versus who they need to partner with. Could we talk a little bit about just what is interoperability in healthcare? Let's just explain it in simple terms. There are a lot of big words there, right? A lot to follow with TEFCA and all of the changes this calendar year. But what are some simple terms for listeners out there?
Yeah, I mean, interoperability is really just an extension of patient care in almost every true sense. It's data that gets shared about a patient or about an organization in service of that broader mission of providing care. And so from an interop definitional perspective, we have now in statute actual definitions of what is interop. So it's no longer just up for opinion or just individual interpretation. It's the actual full sharing of the patient's data securely, of course. And there's specific language in the definition of 21st century cures that speaks to without special effort. So interoperability has to work seamlessly, securely, provide the full and complete access, and it should not require users to do any special extra work to enable the activation or the sharing of that data. And then finally, the last kind of big important piece, which is sort of new for the industry, is that interoperability should not constitute information blocking. So interoperability are all the activities that you might do to share data, but it cannot be information blocking in the sense that organizations that might otherwise compete with each other cannot, because of that competition, choose not to share data. So we're flipping a bit of a script from the HIPAA world, which HIPAA of course still applies, but the default position in HIPAA was do not share the information. With interoperability today, the default position is you must share the information for all authorized users who are entitled to access it. And it has to be the complete information without special effort. And so that speaks to automation, it speaks to APIs, it speaks to seamless technology that's mirroring a lot of the modern tech that we have in practically every other aspect of our lives, from social networks to the AI releases that have been happening. They're all leveraging modern tech stacks. And now interoperability in healthcare definitionally means that same capability is now available for EHRs, for health tech vendors to use to get and access data that they are authorized to access. So, and again, it's all in service of that patient care story, helping patients get better experiences and better outcomes.
Yeah, that's great. Thank you so much for walking us through that. And, and I think about to client conversations and market conversations, and you still just hear of these hurdles of, well, can you connect with this system? Can I get this type of record? And you just still hear of these kind of barriers, or what is a client's perspective of a barrier within the technology. Can you walk through some of those challenges, that tend to hinder interoperability or make it tough for organizations to feel like they have that access?
Yeah, absolutely. It used to be the case that, just adopting an EHR or buying some tech solution would get you some ways towards accomplishing interoperability or delivering on your interoperability needs. But often interop for the patient experience meant the patient was the one carrying their records with them in a binder. And sometimes interop for a practice in the old days meant faxing a record to another provider or waiting on the fax machine to get records. So there used to be technology barriers. There used to be process and operations barriers, things like I mentioned with the competitive drive that most organizations have. Organizations want to hold on to their patients and want to be jealous of the sharing of that data about those patients. So there always historically have been these operational and business blockers. But now with the regulations around info blocking, with the advent of tech like FHIR APIs and modern frameworks in the healthcare space, those barriers have quickly, one by one, been eliminated. But there are still operational challenges and trust challenges, like turning on access to a national network. Does that mean that law offices will now be able to query your practice and get copies of records for things like tort research or plaintiff discovery? And so these are the kinds of things that are not necessarily blockers, but they certainly are operational considerations when activating interop solutions. And I think one last piece is with the new kind of forward advancement of all technology, interop in the healthcare space has not historically stopped or prevented the use of previous methods of exchange. So we still see a huge amount of faxing in the healthcare space. We still see a huge amount of clicking for data with remote desktop and web login credentials to apps. And so there's still a huge opportunity to actually turn on the level of automation and the level of integration that the technology can actually deliver. So there's still that end user education and organization education, but it still requires some level of operational consideration to make sure that the interop that you turn on is integrated in your solution and doesn't require special effort, as we saw from the definition.
Yeah, that's super helpful. And I hear a few key things in there that a lot of organizations have challenges with outside of just interop, but change management. So being ready for it operationally, making sure that the end users have the training and the workflow enablement to understand how to use and what to use, and that the patients of their practice have the training as well. What are some other steps or ways that organizations can help to prepare for how technology and interoperability is evolving and changing, especially over this calendar year with what's coming, but in other ways too?
I think for ambulatory providers, there's a lot of capabilities that are now delivered as part of the EHR, right? And so they're not external applications or other purchasable devices or services. The interoperability is now really built into the core functionality of what all of these EHRs are expected to provide. Out of the box connectivity to national networks, out of the box support for APIs that are really deep from a clinical perspective. They provide all the access to the structured clinical data about a patient. So these capabilities all now exist. And I think it's incumbent on organizations in the ambulatory space to make sure that they've activated as many of the services that are built into their tech that are delivered out of the box with the EHR. So here at NextGen, that would be things like our FHIR APIs for patient access, our national network connectivities through our NextGen Share, managed services, and then with our new partnership with our QHIN, turning on the QHIN connection is going to get you a huge amount of external data from Epic and other EHR systems. So it's really doing that gap analysis to see what is available from my out-of-the-box EHR. These are very capable systems today, and a lot of that capability is built right in. And where necessary, where there are use cases that a third party might provide, a lot of the functionality is also being driven through API marketplace solutions. So you may not get all of your solutions from one and only one vendor, but that technology should be an enablement for the apps that you might prefer to use. And so we've really taken an ecosystem approach where we engage with all of the leading out-of-the-box national network connections. We solve that for customers right out of the gate. And then for things that organizations may choose to add on, we're enabling that through our API program and robust connectivity to hundreds of apps that clients can pick and choose from.
Yeah. So talk to me a little bit more about that API first organization and being that kind of ecosystem that enables vendors, but also organizations leveraging technology to really power that ecosystem, right? Leveraging, of course, best in class, what technology here at NextGen provides out of the box, and national, regional interoperability connectivity, but also just from an API first organization. What does that really mean to a customer looking at technology, and what do they need to power for their day-to-day operations?
Yeah, I think if we just start from the premise that EHRs historically were just the record of truth, right? It was the repository for all the historic information about a patient, their conditions, their activity, and all of those things. EHRs are really modernizing now, and NextGen especially, to be not just the record of truth, but the context of the truth. The full context of the patient's record involves much more than just what meds is the patient on, what's their problem, but all of the encounter history, all of the telephone and digital and telehealth encounters, and all of that is centralized in the EHR. An API first solution means that all of that data is not locked behind the walled garden of this one vendor's solution. And an API first solution really requires that before the technology adds a new feature or adds a new capability, the developers of that tech here at NextGen, we've thought about how to integrate and make that data available to our customer, but also to third parties customers may choose to integrate with. So when we talk about being an API first solution, what we specifically mean is when we add a capability, we're also going to empower that capability in our API so that it can be consumed by other third-party services. So if we're rolling out a new AI solution, it's easy to integrate with a third party. If we add a new mobile capability, it's leverageable by downstream apps. So API first implies that the developer has thought about not just the data model and where is it going to be stored in the database, but how is it going to be accessible and opened for consumption by the customer and third parties the client may choose. And that's a really important shift in the software development space, I think in health tech more generally, because again, the goal is not to lock the data in a system of record and then just have that be the one and only one spot. Rather, a system of context means that external systems can integrate, can discover data about a patient, can add value on top of what that core record actually provides. So that's how we're really thinking about APIs as an enablement solution for customers to go further than things we've shipped. You can add capabilities and take the data, your data, and really make it useful in ways that maybe we haven't even imagined.
Yeah, I want to dig into a little bit. Those are all really great points. And something stuck out at me a little bit, and that is the added value, enabling organizations to use what's empowered to them and make sure that what we as a technology vendor or a partner in the industry are providing is added value to an organization and to their patients, right? Their care population overall.
Yeah.
The industry, the market, they're very keen on ROI right now and their return on investment. But, more particularly, I think back to my days back in practice, keenly interested in if you have a technology providing and enabling these technologies, enabling these ecosystems and API first abilities to connect in, specific ways that we can power efficiency, providers, administrative, patients, clinical decision making. There's a lot of different areas that we can kind of dissect out what does an ROI from an interoperability investment standpoint mean for an organization. As simple as a patient, I think back to my days of a patient leaving the appointment and they'd say, can you print out my note for today? And they'd wait at the front office waiting for us to print it on a printer and walk it up to them so they could walk out with it.
Yeah.
And so you just think of the trickle effect there of them bogging down the front office, let alone the printer of paper and the security and compliance of their records, floating on a piece of paper. So kind of a lot there, but I would love to just dig into specific examples where we're really driving efficiency for organizations. Maybe talk a little bit about how we have seamlessly integrated when documentation comes in through CCDA, how an organization can review it, consume it, match it to their record. Do they already have the data or not have a data? Because it's a really great way for organizations to understand the power of lessening clicks, the ability to integrate and consume in the information and drive efficiency for their staff.
Yeah, ROI gets measured in so many different ways at different organizations. I think you touched on like some of these workflow challenges, like asking for data, waiting for it to be available, providing it to a patient. Every one of those steps is time. Time in the healthcare space, of course, is money. And so when we work with customers and talk about their interop needs, it's often how can we automate some manual steps that are happening today? So the manual step, like you were saying, of chart retrieval, what's happened to my patient, in the last few weeks before they come into my office? What are the most recent hospital admissions? Returning a list of labs or imaging procedures or tests. The most basic kind of ROI for interop historically has been told in the sense of reduce duplication of testing, right? Reduce like the patient anxiety about having to go through another test, the cost to the payer for paying for another test and all of those things. So there's like obvious ROI there to just not repeat procedures unnecessarily. That's obvious. And I think that's a good for all time zone kind of win when you turn it on, of course. But beyond that, automation of human effort and manual steps is another key unlock from an interop perspective. So being able to receive an encounter notification when your patient's admitted to the hospital saves you time from having to go check a census and see where your providers might be rounding. You can just know that your patient is there and go directly to that visit, perhaps. And so I think matching workflows, literally like almost like time level studies. Where are my staff spending their time? Mapping that to the capabilities of your integrations is all about reducing the human effort to get data, to share data, or to prepare it for the next step in the workflow. And I think a lot of those ROI elements are defined kind of at that practice and literal the location level, right? Because even in a big organization where you have 20, 30, 40 locations, dozens of providers, each locality might do things in a slightly optimized way for their area. And there are always steps in the workflow that are very manual, and that is what we can cut out and reduce from an integration and interop perspective. So we like to tie it to workflows that are meaningful to the local provider in that clinic. And that's where we can uncover things like, hey, if we had a feed from the hospital, that would solve this time. Or if we had a better integration with this medical device that's in our office for diagnostics, then we could save the time of getting the record and scanning it or doing some other manual steps. And so that's really where I think we encourage customers to focus is find all of your manual workflows and let's go through them one by one to find the right integration.
Yep, that's exactly it. And circling back to kind of the earlier conversation around educational, foundational knowledge of what does your technology have today that they can power and unlock for you. So many organizations don't realize the power of interoperability already in their core platform that they're leveraging, and being able to unlock that and just being educational and driven in workflows and trained through that. Switching gears slightly, let's talk a little bit about Mirth Connect. How is it supporting secure and scalable systems across other systems as well? Talk to me a little bit about what Mirth is.
So Mirth Connect is our awesome integration engine. NextGen acquired this technology back in 2013, and we've done an enormous amount of effort to integrate core Mirth Connect capabilities into the broader NextGen ecosystem. It's how we launched our managed service for interoperability, the NextGen Share platform. That runs on Mirth Connect and benefits from Mirth Connect for integration. So a lot of NextGen EHR interoperability, along with some other leading EHRs, leverage Mirth Connect as an integration engine to do more than just what comes out of the box. And then we have a whole part of our business, of course, that is just Mirth Connect only customers who are maybe labs or pharmacies or radiology or med device vendors are actually a big market for us. And so Mirth Connect does a lot of the heavy lifting across the whole world of healthcare interoperability. And I'm really proud of the fact that we still have a huge community of users today who use Mirth Connect for research. And that's actually one of the really cool things about this integration engine. It is loved and deeply used by the research community. So for those who like to nerd out on research studies, if you just search on Google Scholar, you'll find roughly about 30 or 40 clinical studies every year that reference and rely on Mirth Connect to do patient data sharing or data quality massaging or all kinds of other use cases. So it's a huge solution for us. It's one that we care about deeply. We've invested a lot in growing that part of our business and improving that product and modernizing it for today's interop requirements. So Mirth Connect today supports, Fire R5, the latest version of the Fire release spec, and does a ton of out-of-the-box interop capabilities for organizations of all types. So it's a really great solution, a Swiss Army knife of integration, as we like to call it.
Yeah, that's awesome and incredibly exciting with all the new features and enhancements and the evolution that it continues to follow. Can you talk to me a little bit more about the Mirth Command Center? Yeah. How will it elevate that user experience?
Sure, absolutely. So Mirth Command Center is kind of a web hub for all of your Mirth Connect implementations or deployments. Command Center gives customers a kind of one-stop shop to see all of the activity across their fleet of Mirth Connect instances. So usually, not all the time, but for many organizations, you have complicated networks of connectivity or many different endpoints they need to connect to. You may need a solution that helps you kind of manage your Mirth Connect deployments, keeping them all in sync, keeping channels active. And so Command Center is a tool that we've released about 1.5 years ago that provides that one pane of glass for managing all of your Mirth Connect activity across your network. And Command Center is where we've also begun introducing some new functionality and new features because the Mirth tech stack is very, it's growing. There's a lot of capabilities across Mirth, but the Command Center gives us a way to launch new web and lighter capabilities that don't necessarily require you to take the next upgrade you can just add capabilities and add features right from Command Center. So one kind of tangible example that I can share is we've recently launched with our 4.7 release, a new service, a message archival and reprocessing service. So to help solve one of the challenges a lot of customers have with their analytics and data store is these files can get quite large, and they could be difficult to track over time. And one of the challenges with kind of some of the legacy patterns of data exchange, sometimes when messages fail, you have to resend them, you have to retry them. And so customers historically had a challenge with that archival of audit messages, and retrying failed messages historically could be a challenge in a cloud environment. So now with Command Center, we've just solved all of that for customers. It's built right in, and you can add message archival or reprocessing to channels that are mission critical and important for like an SLA perspective. So we continue to innovate on the space and add new web capabilities to the integration engine, which tried and true, right? It works, but it could definitely benefit from some modern API capabilities, and that's what we've introduced with the Command Center function.
I hear your energy and your excitement around the advancement of interoperability and technology with Mirth Connect. What are you most excited about around the future of interoperability and or Mirth Connect?
Well, I think, it wouldn't be a podcast if we didn't talk about AI, right? Like we would just be missing the boat, right? If we didn't drop in the AI references. But without being too facetious, AI, I think, is going to redefine what all of interoperability means. Certainly agentic interoperability that just operates on behalf of whether it's the integration engineer or the CIO at the clinic. Agentic interop can take the structured actions and just scale that up in a dramatic way, following the rules that are defined by the clinic and the organization. And we're already seeing kind of the marriage of some of these agentic AI solutions with the API capabilities in Fire or proprietary APIs to take integration stories to a whole new level. So one kind of immediate example is we've been using AI on the Mirth side for something we call Mirth Assist AI. And so when there are complicated tickets or troubleshooting items around a failed integration, or this message failed to post in the system, or we're getting this kind of error, getting to a resolution is now much faster with a Mirth AI that can read the logs of the transaction and then find the breaking step and suggest a course correction. So from a support perspective, we're finding faster mean time to resolution on cases just by having an AI layer analyzing the logs and identifying issues. But beyond that, I think the thing I'm most excited about is when organizations tie in the whole clinical workflow. And now there's this intelligence layer that can decide, when do I need to go and find data? What are the number of connections I have access to? Where can I get this data? And bringing that data back, integrating it with an EHR, using an API-driven model, I think it's going to redefine what all of interop actually means. There's also kind of the corresponding story that with just natural language, what does it mean to have structured clinical vocabularies for all this data? Why do we need ICD-10 and RX norm codes and NBC codes if we can just speak natural language and the AI can interpret or extract from that natural language all of the coding that represents that data? There's a belief, I think, in some circles that this natural language can potentially replace all of what we're seeing in interop. And I was really excited to see in the New England Journal of Medicine at the end of last year, there was an article that actually referenced Mirth Connect. And one of the studies specifically called out that using AI solutions, natural language processing, and structured clinical data together gets a better result than just using any one on its own. And so I think there's a huge opportunity space for developers, for integrators, for clients of all types who want to then marry some of this structured clinical content. We now have APIs. We now have structured vocabularies, we have standards. Marry that up with your clinical use case that maybe is just natural language, maybe it's just narrative notes, maybe it's images and documents. There's a huge set of opportunities here. And we're not going to find or build all of those solutions ourselves, right? We're going to hopefully enable with our tools customers to take these tools off the shelf and then define their own use cases. So I'm really excited about what this whole interop space is going to look like. And just probably within this year, we're going to see a lot of what this TEFCA and QHIN world looks like. And I think we're going to see what this agentic AI world looks like. And together, who knows what's going to be coming for the interop space. But I'm really excited about adding this new capability on top of all the great hard and heavy lifting that the whole healthcare IT space has done to digitize the data and get it all ready for these new tools. Absolutely. I think it's a great time to build. And I welcome everybody who wants to join us and tell this next part of the story together.
Absolutely. That's been great, Mo. Thank you so much. And it certainly bodes back to your initial comment around system of record versus system of context and nods towards how fast the evolution of the industry just in health IT is moving, right? With AI and interoperability and all of your key points.
Yeah.
Well, Mo, this has been a fabulous conversation. We thank you so much for joining the show today. It's been incredibly enlightening, and I hope that others have been engaged and enjoyed just as much about interoperability and the expansion as well. Listeners, thank you for making the time to join us for today's session and episode of In Practice. Be sure to subscribe on Apple's podcast or Spotify so you never miss an episode. Until next time.